So I'm about to go to surgery. It's like almost 9 and I have to be there 9:30. It's like 5 minutes away, but I'm dressed in all baggy clothes. So it's not gonna be on decisions or anything, hopefully not. Super nervous, have to pee so bad, but I don't want to pee and then not have to pee there. So I'm trying to hold it. There's be some videos or footage of the process, but we'll see what happens. But please wish me luck. I'm really nervous, but my hand's like shaking right now. But I guess I'll show you my little bag. There's like nothing in there. So I have like my camera in here. I have some pads. I have like a smoothie. This is for the chemical peel in case my skin starts peeling. And then I have some like food options just in case they don't have food that I can eat in there with all my restrictions. So So we're on our way to the hospital, so come with me. I'm super nervous. Super nervous. Like, they didn't give me any medicine to like calm me down or nothing. So, oh, I'm gonna pee my pants, but that's a different problem. So we're walking into the hospital. I'm so scared. But I also have to pee so bad, so I'm excited to pee.
I feel like a camel.
Camel? Why?
Camel's backbone is heavy.
So just to keep you guys updated a little bit, as soon as I checked in, I asked if they needed a little pee sample, and they lied to me. So I peed. And then as soon as I walked into the little area, the waiting room for me, the patient room, I saw the little urine cup and I said, oh my God, the lady said I didn't need it. So learn from my mistakes. Hey guys, so I'm about to go back into the surgery place. So I'm nervous, really nervous, but she poked me. Hey guys, so this is the following day for my surgery. So the surgery was yesterday. I just took my first shower. My skin is peeling a lot. I just put some lotion on it so it's not as bad, but it was peeling a lot. But earlier today, I could not stop throwing up. I couldn't take anything down without throwing it up. But thankfully, I was able to take like a longer nap because I woke up at like 6 in the morning just from pain. But thankfully I was able to take a nap, and then I was able to get some Sprite down, and then like half a taco, and then some applesauce. So making some progress, and I feel a lot better. But earlier today I was like, I'm gonna take a medicine. Oh man, that was the wrong choice because I just kept throwing up. I don't know if it was due to the medicine or if it was just due to all this pain. And they didn't even take anything out. They made 2 incisions, and then the doctor was like, oh my gosh, this is spread everywhere. There's endometriosis in a lot of places that is like difficult to get to. All in my rectum, uterus, and ovaries. So she was like, I'm not going to take any of this out. I don't want to cause any future problem. I'm just going to get all the video and footage that I can and then refer her to a specialist. So I've been looking into like the Mayo Clinic, the Cleveland clinics, a bunch of like specialists obviously for endometriosis. The doctor that was performing my surgery, she said since it's in my rectum as well, with like one wrong incision, I could have like one of those like poop bags for the rest of my life. And I was like, oh my God, I'm so happy that she knew her limits and she knew that I was out of her like realm of expertise, I guess. I was so happy knowing that she didn't take anything out. She just got all the footage that she could from those 2 incisions, one on my belly button and then one on my left side to see the rectum. And she was like, wow. So thankfully the surgery went well, but the results were not so good. But at least I know I'm not delusional anymore. Just because it's when I went to the what's it called? When I went to get my, it'll come to me, hold on.
A few moments later.
It's when pregnant people ultrasound. When I got my like vaginal ultrasound or whatever it's called, they were like, yeah, nothing's showing up, and it's normal for it not to show up, but it's also like, it makes you second guess the pain. And I've seen so many YouTube videos of endometriosis, like their stories with it, and they're like, I just feel like I do have it, but I don't have it, and it's really like stressful because you don't want to waste a lot of money on potentially not having it. But I'm really glad that I chose to not go the birth control route, because the doctors were pushing birth control so heavy, and I was like, I've been on it for so long, like since I was a little kid, and I got off it around like, I don't know, around like 19, maybe 18, I think 19 or 20. But anyways, I was on it since I was like 15 or 14 for so a lot of years, and I was like, I'm not getting back on that. It's thrown my whole hormones, and it was not a good process. Anyways, and plus I couldn't take medicine like that at the exact same time every night, and it was just a disaster. But yeah, I was like, I'm not taking any more medicine. I just want to get the surgery. If I have it, I know. If I don't, perfect. But with that being said, I have it, and it's a lot. So, specialist, here I come.